Can lifting weights actually improve your heart and blood vessel health? A new study on healthy young men says yes, as long as it's at the right intensity. Researchers took 32 young men and had half of them resistance train at a moderate intensity. What do I mean by moderate intensity workouts? The researchers had them train at about 65% of their 1 rep max 3 times per week for 8 weeks. The other 16 men, no training whatsoever. So what did the participants do that actually trained? As I said, they trained 3 times per week for 8 weeks using those moderate loads, about 65% of the 1 rep max. What they did was a circuit of exercises. They did curls, tricep extensions, shoulder presses, chest press, sit-ups, straight leg deadlifts, walking lunges, and squats. They did 3 sets, 8 to 12 reps, with about 15 seconds between each exercise and 3 minutes between the circuits themselves. Sessions lasted approximately 60 minutes in time, and they retested and adjusted loads at week 4 to ensure they stayed at that 65% of the 1 rep max for each exercise. I'll put a link to the study below so you can see. So here's what changed after those 8 weeks. The researchers measured how this training affected the flexibility and function of their blood vessels. They found that arterial stiffness improved. This measurement, called PWV, dropped. What does that mean? PWV stands for pulse wave velocity. This measures how fast blood pressure waves move through your arteries. Faster speeds mean stiffer arteries, while slower speeds indicate healthier, more flexible blood vessels. This is really good news because lower PWV equals less arterial stiffness, which is tied to better cardiovascular health. They also found that resting artery diameter increased and FMD decreased. What is FMD? FMD stands for flow-mediated dilation. It's simply a test of how well your blood vessels expand when blood flow increases. But don't freak out. A lower FMD reading does not mean that the blood vessels got worse. Why? Because resting artery diameter increased. So there's less need for relative dilation during these tests, but their maximum expansion capacity remained the same. Essentially, FMD went down slightly, but that's because the arteries were already wider at rest. So the relative percentage change looks smaller. Their maximum ability to expand did not decrease, and that's what really matters. It's also worth noting that they measured blood pressure and heart rate and found no change at all. Okay, so what's the takeaway of all this stuff I just said? This study essentially concluded for healthy young male lifters that moderate intensity training, about 65% of the 1 rep max, like I mentioned before, looks like it improves arterial stiffness and widening of the arteries, even if FMD looks lower on paper. It's also worth mentioning there's limitations and some nuances to this. This study was conducted only on healthy young men with that average age of about 19 years old. And they only did this for 8 weeks. The researchers also clearly stated they did not look at markers such as nitric oxide or endothelin 1. What are those? Nitric oxide and endothelin 1 are 2 key molecules that control how your blood vessels behave. Nitric oxide is a vasodilator, so it relaxes and widens blood vessels, improving blood flow and lowering blood pressure. Endothelin 1 is a vasoconstrictor. It tightens blood vessels, which can raise blood pressure and increase stiffness. Why does that matter? Measuring nitric oxide and endothelin 1 would have helped the researchers understand why the vascular changes occurred. For example, if arterial stiffness decreases after training, is it because the nitric oxide levels increased, promoting better relaxation? Or did the endothelin 1 decrease, so there was less constriction? Without these markers, we know the effect, but not the exact mechanism. I'm sure there will be future studies conducted to investigate this a bit more, and I'd really like them to measure both of those markers to understand the why behind this. The results of this study were pretty fascinating because these are typically results you see with cardiovascular-based training. I just thought that was kind of interesting and worth discussing, especially because of the age of the young men they conducted this on. I've seen other research for elderly populations that's kind of similar to this, but not so much on younger individuals such as the subjects of this study. Okay, guys, that's the study I wanted to discuss, and that's pretty much it. If you guys enjoyed this and want some more fast science investigative type discussions, let me know. Also, if you have a topic you'd like me to look into, write a comment and I'll see if I can figure it out or decode it a bit. And you guys know the drill. Comment, subscribe, like this stuff, and yeah, let me know what you think. And I'll see you guys next time. Peace.